So, what I want to talk about here is a little bit of DIAF. I've been having a few patients giving me a few calls, asking some questions, sending some messages about what is die-off and what can they do about it. So, when you're working with microbes in your body that you're trying to get rid of, whether that's bacterial or parasitic, even virus sometimes, the body as it's clearing them out, it gets overtaxed in your liver with the die-off of these organisms. So some things that you've got to be able to do is before you even start a protocol is make sure that your liver is cleaned out. Make sure that you've done a really good job eating clean, getting rid of inflammation so that you're ready to do this. Some ways that you can test to see if that is a possibility is to get your blood looked at under a microscope. You can be looking for some things like specules or acanthocytes. Some other options are to run your blood work and make sure that your liver enzymes and other liver panels are clean. So that's a start. So what are die-off symptoms? Die-off symptoms can be anything from feeling like you have flu-like symptoms, headaches, snapping at people around you so you're a little angry. I've even had patients come in where it's difficulty breathing. They feel like everything's pinching around them. So those are some of the die-off symptoms. And one of my favorites is patients come in, my calves are feeling so tight. I'm like, okay, well let's work with your protocol so that we can make sure that this process is as easy as it can be on you. I've had patients go through other protocols where Herxheimer reactions happen where they're just in massive amounts of pain and fatigue, and that's just not necessary. So some things that I like to do is I like to use a few different products. One is from Systemic Formulas called Bind. It's a nice little black pill, looks like some activated charcoal, or Takasumi from Supreme Nutrition products. Also, if the person can handle it, use NAC, molybdenum, or Chloroplax from some of the other companies that I use. So there are some products to help you rid your body of toxicity. There's also some protocols you can do. I refer out to a lymphatic massage therapist here in Kansas City, or recommend it when you're a virtual patient. Also doing infrared saunas, Epsom salt baths, and a few other different protocols. So just know you don't have to feel horrible as you're going through this process. There are going to be some down days and some up days. Just make sure you communicate to your doctor. If you have any questions, message us and share this video out to anybody you think could need it, because die-off just doesn't have to be a horrible experience. You don't have to be going through the Herxheimer reactions.